Joining me now from New York City is Dr. Laura Cobb with Resolve to Save Lives. That's a global public health initiative dedicated to stopping cardiovascular disease. She's Director of Nutrition Policy there. Laura, this is a huge problem, isn't it? Talk to us about the problems associated with salt. We heard, the medical issues there in China, and tell us how your mission is trying to turn things around.
Sure. So the goal of Resolve to Save Lives is to save 100 million lives over the next 25 years through three simple interventions. One is reducing salt or sodium intake. The other two are treatment of high blood pressure, and then finally elimination of dietary trans fat. Cardiovascular disease is the #1 killer worldwide, responsible for more than 30% of deaths, and many of those deaths are in low and middle income countries. As you heard in the segment, in China alone, 40% of deaths, more than 40% of deaths are due to cardiovascular disease, and high salt intake is responsible for about 500,000 of those every year.
Huge numbers. I had a relative, first thing he did when you put the plate on the table in front of him, grabbed the salt shaker, wouldn't even taste it, had to salt everything. Some of this is ingrained in folks. How do you turn that around to change people's behavior?
Sure, there's a couple of things. One, I think a lot of people right now, both in China and certainly in the United States, know that salt isn't good for them, but they're not necessarily motivated to change. So I think it's really important that we help motivate consumers to change their behavior. That's some of what we're trying to do in China with the launch of a mass media campaign in Shandong and Anhui provinces starting in September, as well as on CCTV. That said, it's still really difficult to change behavior, and consumers are not operating by themselves in the world. Government really needs to take action to help support them by introducing policies that can help reduce salt in processed food, as well as in restaurants, as Chinese diets and diets around the world are increasingly turning to processed and restaurant food.
What about low sodium salt?
Yeah, low sodium salt is a really promising intervention. 70% of the salt in diets in China, for instance, comes from cooking or salt added at the table. And low sodium salt could potentially be replace the salt that they use on a daily basis. Low sodium salt is often about 25% potassium instead of all sodium. And so that would reduce 25% of your sodium intake, and that's a huge amount over time. Studies have shown that will reduce blood pressure and can also reduce heart attacks, strokes, and mortality.
So Laura, I noticed you talked about eating out, you talked about processed food. What might you give as recommendations to our viewers right now if there's concerns on their part? I mean, just steps that they could take on a daily basis that would help lower this intake.
Sure. I think it really depends where you are. In the United States, 70% of the salt that you take in comes from processed foods or from restaurants, whereas in China, 70% is added in the home. So your strategies are really going to depend on where you are and what your behaviors are. But really, you should be looking for cooking with less sodium, tasting food before you add salt to it, and then also really checking the labels on food when you buy them. So even foods that you don't think of as very salty, such as bread, for instance, or noodles or rice in China, just think about how much you eat that, and just be aware of how much salt might be in what you're buying.